We presented an update last EHA about Iberdomide in this Phase I/II study. Patients were treated with either Iberdomide as a monotherapy or Iberdomide with dexamethasone, or Iberdomide dexamethasone with a third drug, either Bortezomib, Daratumumab, or Carfilzomib. And at this EHA meeting, we had an update focused on the efficacy and safety data of the triplets. So in this study, heavily pretreated patients were enrolled. Approximately 1/3 of these patients were triple class refractory, so refractory to IMiDs, proteasome inhibitor, and a CD38 antibody. And when we look at the safety data across these triplet cohorts, I think it's important to mention that hematologic toxicity was infrequently observed, and also grade 3/4 non-hematologic events were uncommon. So few rash, few gastrointestinal events, and that's important when it comes to quality of life. When we look at the efficacy of IberDd in the 37 response evaluable patients, then the overall response rate was 46%, which is quite high because a substantial proportion of these patients was pretreated and refractory to Daratumumab. When we look at the 25 response evaluable patients treated with IberVd, then the overall response rate was 56%. Again, also here, there was a substantial proportion of patients that was refractory to proteasome inhibitors. And finally, there were 8 response evaluable patients that were treated with Carfilzomib dexamethasone. And in this cohort of patients, the overall response rate was 50%. And again, most of these patients were refractory to previous therapy with a proteasome inhibitor. So in conclusion, I think we can say from these triplet cohorts that Iber with Daradex, with Bordex, or with Carfilzomib dex is showing a favorable safety profile and also a promising efficacy profile in heavily pretreated patients. And these data further support the development of Iber-based regimens in myeloma, including the application of Iberdomide in earlier phases of the disease. And indeed, several Phase III and Phase II studies are planned in patients with early relapse or with newly diagnosed disease, for example, as a maintenance post-transplant.